Hello, I'm Dr. Silvia Carrara, Director of the US Program at Humanitas Research Hospital. Together with Professor Luigi Laghi, Director of the Laboratory of Molecular Gastroenterology and Hereditary Cancer Genetics Clinic, we would like to provide an overview of our paper entitled Side-by-Side Comparison of Next-Generation Sequencing, Cytology and Histology in Diagnosing Locally Advanced Pancreatic Cancer. Genomic analysis of pancreatic cancer have revealed a complex mutational landscape with the four most common oncogenic events in KRAS, TP53, CDKN2A, and SMAD4. Use-guide pancreatic biopsy is the method of choice for obtaining pancreatic tissue, and NGS has been applied to US-guide biopsies and may classify patients based on specific molecular profiles, but the values of USFNB in providing material for genetic analysis is still unclear. A novel Francine needle with a crown-shaped distal tip has been developed with three symmetrical beveled cutting edges with the aim to improve the quality and quantity of tissue obtained under US guidance, with the aim to obtain histological core for pathological analysis. Our study aimed at comparing side-by-side the diagnostic yield achievable by NGS-based identification of somatic mutations versus histological and cytological typing in locally advanced pancreatic carcinoma in sample acquired under US guidance. This was a prospective comparative pilot study on a cohort of 33 treatment-naive patients with locally advanced pancreatic cancer. A 22-gauge acquired needle was used to obtain material from the pancreatic masses. 3 passes were performed in every mass. 2 were dedicated to pathological examination, and 1 was immediately frozen and stored at -80 degrees for genetic analysis with NGS by using a panel of 161 cancer-associated genes.
The slide shows diagnostic yields that we obtained with employing needle according to 3 study technologies, and it was very high for all of them and highest for NGS, where we had available DNA for analysis, good quality DNA, in 94% of the samples. Furthermore, as the table shows, you can see that we got at least 1 mutation per sample in 94% of the samples and more than 1 mutation in most of the samples. Accordingly, our results stands for the feasibility of obtaining DNA for NGS analysis with new needles in most of the cases of locally advanced pancreatic cancer, and candidate this technology as a companion tech for the diagnosis of this disease.